In Rescue Training Session 1, you learned the basics for helping tired and panicked divers. In Rescue Training Session 2, you'll practice responding from shore, using flotation aids, considerations when 2 or more people need help, tows, and exits. Let's look at what to do if you have to get into the water to rescue a responsive diver at the surface from a distance. Keep your eyes on the victim and get your mask, fins, and snorkel. They'll usually save you more time than it takes to get them. If you're wearing a buoyant exposure suit, you may need weights to snorkel down if the victim sinks. You can ditch the weights once you've made contact. Don your gear and enter the water as close as you can to the victim to minimize swimming distance. Keep your eyes on him the whole time, and if possible, get bystanders to point to the victim in case you lose sight of him. Enter without splashing or going under so you don't lose sight of the victim. Pace yourself so you can get there quickly but conserve enough energy for the rescue and tow to safety. Swim with your head up and eye on the diver. You can use your arms to save your leg strength for towing, but save enough arm strength for the rescue. Set your pace based on the environment and the distance. When you stop to evaluate the diver, be prepared to quick reverse by leaning back with your feet toward him. This puts you in position to kick away if he approaches you. You'll practice this move in Rescue Training Session 2. If available, you'll want to take emergency flotation with you when you assist a tired or panicked diver, or have someone throw flotation to grab on the way out. Keep the flotation between you and the victim and extend it to him. Flotation simplifies the rescue by providing immediate buoyancy and allowing you to avoid contact. You may find it easiest to tow the diver to safety by the flotation device. If you don't have a flotation aid, you may be able to improvise one quickly. Otherwise, you'll have to rescue the diver without one like you've already learned. It's rare, but it's possible to be in a situation requiring you to help 2 divers at once. Your best options are non-swimming assists and having multiple rescuers, but that's not always possible. A flotation aid of any sort will greatly simplify the rescue. Give flotation to the diver who appears in the most urgent trouble. Making sure that solves the immediate problem, go assist the other. You may need to separate 2 panicked divers. Inflating both their BCDs from behind or from underwater usually accomplishes this, plus solves the immediate problem by making them buoyant. If handling more than 1 panicked diver presents unacceptable risk, stay clear until one or both exhaust themselves. Remember, to be able to help, you must stay out of trouble. In Rescue Training Session 1, you practiced towing the victim to safety. Let's look at some other towing and exit considerations and techniques. After the initial assist, when you're ready to head to safety, you may want to consider removing equipment. If you're close to the boat or shore, that's seldom necessary. But if you have a long tow and swim ahead, equipment removal may save time and energy. You need to consider the environment. An exit through rough water may be more effective with scuba gear to breathe from. In that case, you probably wouldn't ditch any gear. Consider the diver's condition. A fully recovered diver may not need to get rid of any gear. A very tired diver in a buoyant exposure suit, on the other hand, may recover faster and get to safety quicker with the equipment's bulk and drag eliminated. In Rescue Training Session 1, you used 1 or more tows. The ideal tow keeps the victim's face out of the water, reduces drag by keeping both of you relatively horizontal, doesn't restrict your swimming, and lets you maintain eye-to-eye contact and communication. Different tows accomplish these to differing degrees. The underarm tow reassures the diver with good communication, eye contact, and direct control and support. The modified swimmer's carry, or push, is less tiring if you have a long way to go and has adequate face-to-face contact. The tank valve tow doesn't offer eye contact or ideal communication, but it is the fastest tow. It's a good choice for a quick dash to a boat or shore nearby. Getting the diver out of the water has its own considerations. How you handle it will depend on the victim's condition, the environment, how much assistance you have, and other variables. If you have not done so already, you may need to help a tired or weak diver out of his gear near the exit. But again, you need to consider the environment. Keeping gear on may be the better choice in circumstances where you need the equipment for an effective exit. To assist a very tired diver walk out, put his arm across your shoulder and your arm around his waist to provide support and balance. If the victim's too weak to walk or must keep his gear on for the conditions, it may be better for him to crawl out. You simplify exits into a boat by removing equipment in the water and by providing the diver with support if necessary. Sometimes you can make a difficult exit easy just by giving the diver time to rest and recover. After recovery, the diver may be able to exit with much less help. Once on the boat or shore, you have 3 concerns to address. First, assess the diver's condition and attend to injuries if present. Second, contact emergency medical care if necessary. Third, even if the diver wasn't hurt physically, be sensitive to emotions. As appropriate, talk to the diver privately at the right time. Don't play the hero, especially at the diver's expense. Some divers may experience self-esteem loss and residual fear. Without minimizing what happened, reassure the diver, emphasizing what he did right.
In the first 2 sections of the PADI Rescue Diver course, you started developing your emergency management skills. Section 3 develops these further by showing you how to develop emergency action plans and by applying the first aid and CPR skills you already have to diving circumstances. You'll also develop your skills for underwater emergencies and handling missing diver emergencies. One way to make rescue efforts go more quickly and smoothly is to have an emergency action plan. An emergency action plan is simply the information you need if you have to handle an accident at a particular site or area. Generally, the plan may consider local hazards, team member roles, and local emergency services. It may include a sequence of steps to follow: emergency contact numbers, a script for what to say to emergency personnel, procedures and considerations for evacuating the patient into emergency care, and considerations that might apply to locally required incident reports. Emergency action plans give you the basis for practicing your rescue skills to learn and be prepared for an accident. You can identify areas to improve and revise the plan based on what you learn. An emergency action plan doesn't have to be complex. In developed areas with sophisticated emergency medical response, the plan may be as simple as call 911. Professional dive operations normally have and maintain emergency action plans, sometimes set up and coordinated by the entire local dive community. In such a setting, in an emergency, your role as a rescue diver would likely be as a skilled team member assisting a dive master or instructor. When diving in a remote location away from a dive operation, you may need a very detailed and thought-out emergency action plan. From your CPR and first aid training, you know that BLS, basic life support, includes monitoring a patient's breathing and circulation and providing rescue breaths and chest compressions as necessary in an attempt to continue getting oxygen to body tissues. Dive accidents may lead to drowning, decompression sickness, or lung overexpansion injuries. Exposure to the hot sun in heavy exposure suits can cause heat exhaustion or heat stroke, and prolonged exposure to cold water can cause hypothermia. All of these emergencies can cause respiratory and cardiac arrest. Some forms of diving and some conditions can cause high physical demands leading to heart attack or stroke in predisposed individuals. These are not dive accidents per se, but heavy exertion in diving can trigger these conditions just like any other physical activity. As a PADI rescue diver, you'll learn to begin providing basic life support to an accident victim still in the water by opening the airway and providing rescue breathing if needed. However, you won't give chest compressions in the water. A diver without a heartbeat must be on a hard, flat surface for effective compressions. As you already know, time is critical for someone who needs rescue breathing or CPR. In diving, it's harder to assess a diver's condition, and you can only do so much in the water. Your focus must be on providing rescue breaths and CPR as quickly as possible without compromising your own safety. The first aid and CPR protocols you've learned still apply in dive accidents, though you have to adapt them. For instance, it may be a 10-minute swim to get a victim out of the water for CPR, but a yell for help might get emergency medical care activated sooner. Primary assessment, as you know, is assessing someone's situation and condition so you can provide the right care with the right priority. Let's see how you would do this in a diving context. First, assess the situation. Look for hazards that might have injured the victim, such as stinging organisms or a boat. Be sure you're safe. Second, tap and shout to check responsiveness. Turn a face-down diver face up. Third, call for help if the diver doesn't respond. And fourth, remove the mask and regulator and open the airway. You'll learn in-water techniques for this later in the course. Fifth, check for breathing. This diver's breathing. You would begin rescue breaths if she weren't. The sixth step is to check for a heartbeat, which you don't do in the water because it's almost impossible to confirm a heartbeat, and you can't provide CPR in the water anyway. A breathing diver may be assumed to have a heartbeat, and you would check for heartbeat with a non-breathing diver first thing upon getting the patient out of the water. Checking for bleeding is the seventh step if you have a breathing diver. In diving contexts, a responsive diver will be able to tell you where to look. Massive bleeding is obvious in water, but smaller yet serious wounds may not be. Look for slices or gashes in the exposure suit. Water can slow the body's clotting mechanism, but direct pressure and elevation above the surface, if possible, will work. Pressure points may be difficult or impossible to apply through an exposure suit. As soon as you're able, and while doing the above, you should be towing the victim to safety. Again, use common sense and good judgment. If help's immediately at hand, emergency care may begin, and more effectively with many people helping. Shock management is the final primary assessment step. The previous steps have helped minimise shock. After getting the diver into a safe environment and assuring breathing, circulation and control of bleeding, continue with shock management as you learned in the Emergency First Response course. Shock, which may be characterised by shallow, rapid breathing, clammy skin, weak, rapid heartbeat, restlessness, and anxiety and confusion, is possible after any injury specific to diving. Keep the patient lying down. In some climates, you may have to cut an exposure suit off a weak patient to prevent overheating or overchilling. You begin a secondary assessment only after determining that no immediate life-threatening conditions exist. If necessary, contact emergency medical care or send someone to do so. Keep the injured diver in the position you found him and examine him as you've learned. looking for deformities and pain. An exposure suit may interfere with a secondary assessment, but if you suspect neck or back injury, you shouldn't try to remove it. Instead, immobilize the diver's head just as you would in any other suspected back or spine injury situation. It may be necessary to cut the suit away to prevent overheating while waiting for EMS. If there's no reason to suspect neck or spine injury, you can begin first aid for any injuries found during secondary assessment. Monitor the patient's lifeline until emergency care arrives. Although underwater problems like running out of air are obvious and dramatic, many are more subtle. Watch for trouble signs like hard, rapid breathing and inefficient, awkward kicking. Dog paddling with the hands usually indicates a diver's struggling. A panic diver underwater may have wide eyes. He tends to be vertical in the water, breathing heavily, just before bolting for the surface using his hands in a desperate dog paddle. Although rare, a panic diver may lapse into passive panic characterized by a near trance-like state. Such a diver may be totally unaware that you're there or what you're doing to help. How you help with an underwater problem varies with the problem and circumstances. Have an overexerting diver stop and rest, ideally hanging onto something stationary. A properly weighted recreational diver in a wetsuit should not have an uncontrolled descent even with a failed BCD. But it can happen with a flooded dry suit or if a diver's overweighted. Often all you need to do is signal the diver to adjust his buoyancy. If necessary though, make contact and arrest the descent by adding air to his or your own BCD. You may need to surface to correct the cause. The opposite problem, an underweighted diver, will only have more difficulty as the dive progresses as his tank gets lighter. Help the diver control his ascent, surface and adjust the weight. Losing weights, a stuck inflator valve on a BCD or dry suit, or improper dry suit techniques can cause a runaway ascent. Make contact and deflate the diver's BCD or dry suit by the quick exhaust valve. Disconnect the inflator hose if it's stuck. If you can't stop or control the ascent, let go and signal the diver to flare out and slow the ascent with drag. Surface at a safe rate if necessary to check on the diver's condition, but don't risk getting hurt too, or you won't be able to help. The most common cramp in diving is in the calf. Help the affected diver by holding her fin tip so she can push against it to stretch the muscle. Gently massage the muscle and give it a chance to rest before moving on again at a slower pace. Entanglement and entrapment can occur, but are relatively rare. In both cases, first have the diver stop everything. Your first concern is to assure the victim has enough air while trying to free the diver. Assuming adequate air supply, have an entangled diver hold still while you slowly disentangle her. Use a cutting tool with great care, only if it's obvious the disentanglement isn't working or will take too long. See the PADI Rescue Dive Manual for more detail about entrapment. If you suspect passive panic, confirm by signalling OK and checking for response. If the diver doesn't respond, take him to the surface, holding his regulator in place. Be cautious, because a diver in passive panic can go to active panic without warning. At the surface, establish buoyancy and tow the diver to safety. With active panic underwater, your primary concern is to prevent a rapid breath-holding ascent. With a breathing panic diver, simply slowing the ascent is your best bet for controlling the rate and getting her to breathe. With an out-of-air panic diver, delaying the ascent may be enough to get her to take your alternate air source. Assume that a panic diver without her regulator is holding her breath. If she won't take your alternate, you may have to push it into her mouth while gently pushing the purge to keep it clear. Even if she begins breathing, the panic diver will likely continue her rush to the surface, so flare to control the ascent. At the surface, establish buoyancy for the victim and calm her down. Stay close and assess the diver for lung overexpansion injuries or other problems that may require further attention and care. A missing diver is a potentially serious situation because if the victim is underwater and not breathing, permanent brain damage can occur in about 6 minutes. Time is critical, and the conservative course is to assume the worst until you can account for the diver. How you respond will depend on the environment and resources you have at hand. When it's apparent that a diver is missing, follow these steps as best you can. Have someone contact emergency medical services or other appropriate authority while you find out where the diver was last seen. Assign people to watch for bubbles and try to determine if the diver may have left the area without telling anyone. If available, immediately assign qualified diver teams to gear up for an underwater search. In clear water and good conditions, send out a snorkeling team because they can enter the water and search faster from the surface. When conducting a search, start where the diver was seen last. Descend without swimming, so you drift the same way an unresponsive diver would. Random searching is slower and less effective than a methodical search. There are 4 patterns commonly used to look for missing divers. The first is the U-pattern search, which allows you to cover a large area with only a compass. It's a good choice when you have several search teams covering different parts of a large area. The expanding square is a good choice when you have only one search team. It's effective in moderate visibility and on irregular bottoms, and you need only a compass. It's most useful when you believe the missing diver isn't far from the start point. A circular search allows you to search a large area rapidly in poor visibility. However, it requires a line and reel and doesn't work well when there are many obstructions on the bottom. The surface-led search requires a boat or snorkeler, a line, and several divers who are familiar with it. But it lets you search a large area of relatively shallow water quickly, with the boat or snorkeler controlling the pattern. When searching for a missing diver, keep these considerations in mind. Permit searches only in buddy teams, making sure searchers have ample air and no decompression time. Don't let searchers jeopardise themselves. Assign someone to keep track of the search teams so they don't get forgotten when the victim comes out of the water. If possible, establish a way to recall the searchers when the diver is found. This is especially important on a boat if the boat must leave to get the victim to emergency care. If there's no way to have a recall, set a time for all searchers to surface and check for your signal to come in. If you don't have qualified divers present to search, you may have to choose a buddy and do it yourself. Search until you find the missing diver, until you reach an air, depth or no decompression limit, or for no more than 30 minutes. After 30 minutes, discontinue the search and turn it over to professionals.